guys are hearing me?
Yes.
Yeah, we're hearing you.
Alright. You, oh, I forgot to tell you something. You remember the lady I was telling you about last week that came to do her birthing plan?
Which lady that?
The Somali lady, Muslim.
Oh, Sarah Magupsi?
Yes, that same
Oh,
lady.
Sarah, pregnant Sarah, yes.
Yes.
Yeah. So she was there and we were talking, and then she was saying, oh, she doesn't want any males in her while she's going through labor, and also her husband. So I was
What?
saying to myself, what?
Why?
What?
Well, she said that it was because of her traditional culture. And I'm like, wow, that's the first time I'm hearing about this. Yep.
Okay. Or it's not no culture. Maybe she just don't know who the father is.
Oh, could be that. Could be that. True.
But guys, are we going
What?
to respect the patient privacy and confidentiality?
What kind of privacy? She pregnant?
That's not a
Well,
nurse ethics, Nurse Williams.
well, I agree with Chris Lee.
Oh.
We
Nurse
should.
updated.
I will.
Really, Louis?
Yes, man, keep us updated, especially me.
Right. Just listen out for the call, you know? What it takes.
Yeah,
Yeah.
man, we'll be there. Good evening, and welcome to Nurses International Service. We begin tonight with a breaking story that has shaken the nursing community and sparked national debate on ethics, privacy, and cultural sensitivity in healthcare. Reports confirm that a group of nurses were unknowingly broadcast live on social media while discussing a confidential patient case. The discussion involved a Somali pregnant woman who had specifically requested that no male doctors or her husband be present during her delivery, a request rooted in her cultural and religious beliefs. The leaked video has since circulated online, raising serious concerns about the protection of patient confidentiality in healthcare settings. Amoy Williams with this report. Thank you. Sources indicated that the nurses were on a phone call, discussing the woman's care plan when one participant accidentally went live on social media. Viewers quickly noticed that personal and culturally sensitive details were being discussed, prompting outrage from both the nursing community and members of the public. Hospital officials have since launched an internal investigation, while professional boards are reminding all healthcare workers of their ethical duty to safeguard patient privacy at all times. Thank you, Amoy, for that report. And in light of this recent incident, we turn now to a group of student nurses from Knox Community College who will be shedding light on the vital principles that guide ethical and cultural competent nursing care. They'll be exploring the concepts of privacy and confidentiality and how these values connect to Madeline Leininger's theory of culture care, diversity, and universality, a theory that reminds us that respect for culture is the foundation of compassionate and professional nursing practice. Let's take a listen to what the student nurses have to say.
Okay. All right. So, yes, guys, privacy is very important. Privacy is the state of being alone or the right to keep one's personal matters and relationships secret. Privacy covers many facets such as physical, informational, decisional, and associational privacy. Physical privacy is maintaining patients' personal space and protecting them from the other patients and healthcare workers while in the medical facility. Informational privacy involves keeping patients' personal data and records from unauthorized access. Decisional privacy means to respect patients' autonomy in making personal choices such as their treatment options and care preferences, and also respect their spiritual, religious, or cultural preferences. Associational privacy refers to a patient's right to choose who they would like to visit and who healthcare workers can share updates about their condition with. Privacy is important to maintain so that there is trust and the individual can make decisions free.
What is confidentiality? This refers to the culturally appropriate safeguarding of a personal and health-related information. In Madeline's theory, confidentiality is a moral and cultural obligation that varies across cultures. Nurses must understand what information is considered sensitive within a patient's cultural context and how it should be protected to maintain trust and a therapeutic relationship. Over to you, Chris Lee.
Leininger's culture care theory emphasizes that caring is the central and unifying focus of nursing and must be understood within the context of an individual's cultural background. She proposed that effective nursing care requires understanding patients' cultural values, beliefs, and practices to provide culturally congruent care that fits their lifestyle and health needs. The theory highlights three modes of nursing actions: culture care preservation or maintenance, accommodation or negotiation, and repatterning or restructuring. Leininger's work bridges anthropology and nursing, promoting holistic, respectful, and individualized care across diverse populations.
Assumption of Madeline Leininger's culture care theory. The first assumption emphasizes that care is essential for healing and well-being, and it varies across cultures. The second assumption, it highlights that understanding cultural differences is crucial for providing effective nursing care. To improve patient outcomes, nurses follow these assumptions when providing culturally appropriate care, and it is assumed that caring and culture are universal phenomena, although their expressions, meanings, and practices differ across cultures. During the recovery process, for example, a nurse may emphasize the importance of healing rituals or family involvement and incorporate those aspects into the patient's care plan. And as for the second assumption, culturally congruent care facilities, health, and well being. Our care becomes more meaningful and beneficial when it aligns with the cultural values and beliefs of the patient. Moreover, it fosters trust and cooperation between the patient and the healthcare team. For example, allowing a Muslim patient to adjust their medication schedule around daily prayer times shows that we respect their religion and we respect their practices, and it supports both spiritual and physical life aspects.
The principle of privacy is fundamental in nursing as it maintains the client's dignity, right to personal space, and control over personal information. This allows the nurse to build trust and to give the best care. Maintaining privacy not only protects the client but also the organization. According to Madeline Leininger, transcultural theory is all about making care fit each patient's unique background. This can include considering traditional healing practices, dietary restrictions, or religious beliefs in their treatment plan, or even inviting shamans or priests to join the care team. The goal is to deliver the care that respects individual cultural needs while upholding universal principles of equality in healthcare.
Hello, Mrs. Magupsi.
Hello, Nurse Ellis.
How are you doing today?
I'm not too bad, not too bad.
Okay. So I'm just calling just to follow up on our meeting last week on your birthing plan, because we're nearing to the end. So
Yes.
I was just calling to ask if there's anything that you would like to add or take away from the birthing plan.
Well, nothing too much. Just that during the process, I don't want any male staff to be a part of the procedure. Not even my husband. I don't want to be there.
Okay, I understand and I respect your concerns about having male staff or even your husband in the room during your care. But can you tell me more about what would make you most comfortable and respected in this situation?
Okay, so the reason for this is because in my culture, it is not appropriate for me to be alone with men who are not a part of my family, especially in a private setting like that, that would be occurring on that day. I would prefer only female staff to attend to me
Mhm.
right throughout that procedure. This is
All
very
right.
important because it's a part of respecting my privacy and also maintaining my dignity.
Okay. And I appreciate you for sharing this with me because I want to ensure that your care is provided in a way that respects your culture and personal values. So
Yes,
I'll make sure to arrange for female staff members to assist you. If there are any specific family members or individuals that you would like to have present during that care, please to let me know and we'll do our best to accommodate your request, okay?
not a problem. I'll notify you if anything changes.
All right. So is that all?
Yes, that is it for today.
Okay, so until the 23rd of November, all right?
Can't wait.
Okay,
Yes.
later.
All right.
Now on to the relevance and sustainability of Leinger's theory. The cure for culture at Leininger, diversity and universality theory is still very relevant in today's nursing since it stresses professional, ethical, and culturally sensitive care. It helps nurses adhere to ethical norms like autonomy, beneficence, and respect for persons while delivering culturally appropriate care that is in line with patients' values and beliefs. For instance, the nurse involves the family in care decisions when tending to a patient who is near death and comes from a culture that values family decision making. This method fulfills moral and legal requirements while respecting the patient's cultural identity. All things considered, Linger's approach aids nurses in providing care that is morally righteous and culturally relevant, enhancing communication, trust, and patient outcomes.